referring doctors, at least now in my community, they order it immediately. And what we've done to make that easier for them is give them a reflex to ultrasound, if dense, order sheet, so that when they order their patient's screening mammogram, their yearly mammogram, they just check that off, and we don't need to call them for another order. The patient doesn't need to call their doctor for an order. When they get their letter that says, oh yes, you do have dense breast tissue, they can just call any one of our offices, and this is around the state. Many of us around our community and around the state has developed these kind of reflex to ultrasound requisitions that have made it more simpler for everybody to get their studies done. That being said, there are a lot of women who do not want to have it done, and that's certainly up to them. You can't make someone have a screening mammogram either, obviously. But once women are told they're dense and they see it, they're very comfortable in coming. And now we're having patients coming back every year. And we're finding that women who had ultrasounds previous year or two, we're finding cancers. These are really small cancers. Certainly all of them that have had prior ultrasounds are under a centimeter in size. So again, and we don't know when we would find these cancers had they just waited with their mammogram. When would they become palpable? When would they be visible within the dense breast tissue on the mammogram alone? What would then the size differential be? And therefore the difficulty in treatment. We know breast cancer, there's so many different kinds. You have women that come in for a mammogram, have a small, high-grade cancer, and we still don't have a positive outcome that we'd like. But I think we at least are getting better at it. Having a smaller lesion, it'll be less costly to treat, and certainly less stressful for everybody.